So new this morning, we're talking about going red for women's heart health. We have Bajwa here from Sanford Health and Jessica from the American Heart Association to talk a little bit about how important this event is, obviously with Wear Red Day coming up tomorrow. Jessica, why go red?
Great question. So for many years, cardiovascular disease was often thought of as a man's disease. And so really our goal is to educate women on their risk factors, educate them on cardiovascular disease in general. It's actually the #1 cause of death in the United States. It takes more lives than all forms of cancer combined. And so it's a prevalent thing that we want people to know their risks for and be able to make some healthy decisions to prevent that.
And obviously being a leading cause of death with cardiovascular disease, how does it manifest differently for women than men? Obviously, you're familiar, a lot of men are familiar with the symptoms of whether that be shortness of breath, things like that, but how does it change for women and what do they need to be looking out for?
Thank you for having me. So women present differently. Most of the time it's ignored. Men have the typical symptoms, crushing chest pain, pain that goes up their left arm, goes to their jaw. Women are mostly queasy, a little short of breath, tired, and sometimes just heartburn. That's all they can tell you, that I'm tired. Sometimes I feel like I have indigestion and mild pain that comes and goes. So very atypical chest pain symptoms for women.
And what is it important, obviously, when you're working with female patients who might be at risk for cardiovascular health, what are the important things for them to be checking out for, making sure they're asking whether that be their family medicine physician or their primary care doctor?
So I usually tell women, get a routine test in your 20s. That's what decides your blood pressure or your heart rate and your weight. And then when you hit your 30s and 40s, go through pregnancies, there's changes in women's bodies, hormonal changes. And that's the time to look at your cholesterol levels and your blood pressure levels, because those get ignored in women. In your 50s, perimenopausal and menopausal women are at the highest risk for heart disease. That's at the time when it becomes the #1 cause of death for women. That's the time to either do weight management or exercise to decrease your blood pressure or cholesterol. And if it does not work, your PCP should start to put you on medication to prevent heart disease, because prevention is always better than cure.
And obviously it's a question that comes up every year this time, or every year this time of year with Wear Red Day. How often do you find patients who may not even think that this could be a problem for them because of just the general messaging around cardiovascular disease?
So women usually tend to ignore their symptoms. Denial is high in women, and most of the time they're so busy multitasking between family, work, and other things. Stress and anxiety gets in the way as well. So most times they'll put it to, I'm just anxious, or I have the flu, or I'm just tired, or I'm getting old. So I usually tell women, don't ignore any of those symptoms. If it doesn't feel right, get it checked out.
All right. Well, thank you both so much for coming on. That's all the time we have for today. Obviously, make sure you're wearing red tomorrow, and we'll have more information on how you can get involved and where you can look for help with those symptoms and what to look out for on our website after the show. Stick around. We'll be back in 2 minutes.